the purpose of this webinar, I think it's very important to just outline briefly why we're here and why we're having the topic of Black maternal mental health discussed today at the NMC. 1 in 5 women will experience mental health issues during pregnancy and in the first year following childbirth. Shockingly, suicide remains one of the leading causes of death among new mothers, and this is published in Maternal Mental Health Women's Voices from the RCOG. Maternal Mental Health Leadership Alliance published that 75% of women impacted by maternal mental health conditions remained untreated, increasing the risk of long-term negative impacts on mothers, babies, and their families. And this research is available at Black Women, Birthing People, and Maternal Mental Health fact sheets. The risk of postpartum depression increases in Black women living in smaller cities or in rural communities, with research showing rates of postpartum depression at 80% higher for Black women when compared to their white counterparts. And this data was published quite recently in December 2023 by the Policy Centre for Maternal Mental Health. So before we get started with our discussion about these hard to hear pieces of information and statistics, I just wanted to note something about the language we'll be using today. So in our standards of proficiency for midwifery, the words women and woman are used throughout. And we'll use woman in some spaces throughout the webinar, but this will include girls, people whose gender identity does not correspond with their birth sex, and those that identify as non-binary people. So we will be using women, but it is with the actual idea of using inclusive language throughout. So over to our 2 speakers. Laura, I think I'll start with you. Could you give us an insight on your journey which led you to work in maternal mental health, but also what attracted you to work as an acronatal teacher and how movement during pregnancy promotes well-being?
Yeah, thanks for having me here. It's great to be here. So I was, like you said, I grew up in Canada. I moved over when I was 3 from England and lived there for 20 years and trained to be a nurse. And in Canada, when you train to be a nurse, you do all nursing, so you don't specialize in one area. So I did children, adult, mental health, learning disability, everything. And my first real job was working in public health, and I worked with the homeless population to support their mental health. And then I worked in obstetrics on a postnatal ward and met a midwife, because in Canada it was 1993, the first registered midwife. And she came in and she was telling me about how she worked as a midwife. And I was like, you get to know the woman the whole way through? You could home birth? Like, it was just blowing my mind. Even though I'm from England, my parents are from England, I'd gone back to England every year, I'd never really understood what a midwife was. So that was it. I packed my bags and I moved back to England. And worked as a healthcare assistant for a while I had to get my registration, and then retrained as a midwife. And it's the best decision I ever made, A, to be closer to my family, but also midwifery is just the most wonderful job ever. And so I worked as a caseload midwife for about 6 years, which was amazing. Lots of birth outside of guidance, birth at hospital, birth at home, but really got to know women. And in part of that role, supported families who had health inequalities, but also suffered with severe to moderate mental illness. So it really sparked my passion to kind of go into this role. So when I had a baby myself, and I came back, the role for mental health midwife came up at the trust where I was working before. So I went for it and thankfully got that post, and did that for 5.5, 6 years. Like I said, I started the Mental Health Midwives Forum because, again, it can be quite isolating role being a specialist midwife, going from continuity where you have that team, we have croissants together, go through your notes, and then all of a sudden it's you by yourself. So we started this forum with 12 of us in London to now it's 180 midwives, I think, across the UK, and even one in Australia and one in Nigeria that's we've kept with us. So I really, really loved that. But one aspect of that role that I found hard was that if women had a baby removed due to social care, or if the baby had sadly died, or if the mother had tocophobia or birth trauma, they weren't being supported by a perinatal mental health team. So when the new maternal mental health services were being established, I was like, yes, this is where I really want to go and support those families where their needs were not being met. So that got me into maternal mental health where I am now. I love this role because not only do I get to support families that I felt like were falling through the net, but I also get to work with incredible humans like Chrissy, and get to do a lot more stuff in the community, which I never really got the chance to do when I had like 3 clinics in 4 days and running around. So that's how I got into mental health. And then the aquanatal so where I worked before, they used to have midwives that would train to teach aquanatal, and the rules changed overnight after I'd just done the training. And they were saying, oh, you had to be a personal trainer to do the aquanatal classes in London. So I went everywhere begging and pleading, saying, please, please, can we do this? I've done this training. And then realized that one of the hospitals where I work has a pool. So we did some funding. We got funding through the Trust charity, and we started running aquanatal classes for pregnant women for free. So we would ask for a donation if they could, try and keep it going, but it was never more than £10 for 4 classes. And it was specifically for women with mental illness and women with gestational diabetes, because I was seeing women in my clinic with both of those diagnoses, and they were saying, I don't want to go to perinatal mental health, or I don't want to do talking therapies, or I've got this diagnosis of GDM, what do I do to be active? So created this nice safe space for women to come, where there's music, there's peer support, and just the benefits of exercise. And it's still going now, and now it's open to all women at St. Thomas's. So it's a really, really great, wonderful thing. Releases endorphins. It's just a time together. The women would go for like tea, because it's by London Bridge, afterwards together. It was lovely.
Well, thank you, Laura. Your passion and your sort for helping has what's led to that class still going. I'm really glad that it's still there, because it sounds like a really, really useful, and it's open to everybody now, not just this group of women.
Yeah, open for everyone. Yeah. As long as you're booked at St. Thomas's. My dream is to have it everywhere, because it's such a nice thing to do as a midwife too.
Yeah, it sounds like something that should be everywhere. Thank you.
Yeah.
That is really great. Thank you. Chrissy, could you tell us about the Motivational Mums Club and the Young Positive Minds, and what led you to set up these organisations?
Oh, what a question. Every time I get asked this question, I just never know where to start. As you mentioned in my bio, I started, as a HR professional. So this has never been in the plan for me, and this is solely, it was born due to my lived experience. As you mentioned, being very senior in the investment banking industry, I was very fortunate to climb up the ladder very quickly. Always been a go-getter. And what happened was that I ended up getting pregnant. And, it was the most amazing pregnancy. I couldn't fault it down at any point. I had a good pregnancy, I had good midwives, I had a good birthing experience. I was on cloud 9. So whilst I was at home and I had my son, Zane, what I did was create the Motivational Mums Club. And when I created the Motivational Mums Club, it was purely just for me to meet other mums and network. And I hosted my first event. And it was such a beautiful event. I had mothers from all walks of life come and talk about, being a single mum, fleeing domestic violence, surviving FGM, being an older mum, and one lady spoke about her stillbirth experience, but then after that, she had her beautiful 2 rainbow babies. So it was such a beautiful event, and I hosted that when my son was only 6 months old. But little did I know, in that beautiful moment, and I was just so, taken away by, these women's, stories. Little did I know, and hindsight is a very beautiful thing, that I was expecting my second born, my daughter. Not only was I expecting her, I was 12 weeks pregnant, and I didn't even know. And that's when my lived experience began. And in that moment, when I found out I was expecting, I was essentially reborn, because I wasn't filled with anxiety. I was filled with anxiety, sorry. I was very anxious. I didn't feel connected with my daughter. And I felt like a sense of me as an individual was being lost, because essentially, am I just going to be a mother? And I've literally just got a hang of this motherhood stuff. And I've been very fortunate when I graduated from uni to, get an internship at Goldman Sachs, the leading investment bank. I was very fortunate to get into Pearson International, and very quickly getting into that organization. I moved on to the Financial Times, looking after journalists at the time, over 600 worldwide. And that's where I moved to Societe Generale. So as I explained, I've always been very quick on that ladder, always been passionate, always knew that I wanted to go into HR. And I just felt like I was losing a sense of me. And I didn't know how to navigate around that, nor was anyone talking about mental health. So I decided to go back to work with essentially a baby, and being pregnant. I just felt myself going on a very vicious cycle where I would literally just go into work, do what's standard required of me. In everyone's eyes, I'm doing well, Tracy. I'm doing brilliant. But for me, I was failing because I've always put 110%, and I felt like I was just doing the standard requirement. Plus, I'm also feeling absolutely exhausted. I will go home, look after my son. All he wants is to play with mummy, rightly so. I've been at work all day. I want to give him that attention because I don't want him to feel like, I'm not there for him. I didn't want to have that guilt. But then I put him to bed. By the time I come back down, it's 9, 10 o'clock. I'm exhausted. I sleep, I wake up, and I'm doing it all over again. And I wasn't giving myself grace. I wasn't talking about it, and I was just getting on with it. So fast forward, I was only at work for 4 months, and went on maternity leave again. And that birthing experience was horrific, absolutely horrific. And I was very much in tune with my body because I had my children very close together. I knew when I was in active labor, I wasn't listened to, nor was I heard. I wasn't seen. I was very much dismissed. Got sent home 4 times. So bear in mind that I'm already, trying to navigate in my mind, am I losing Chrissy? I'm not talking about it. I feel very heavy, and I'm holding it internally, to now I'm literally, essentially trusting someone with my life and my baby's life, and I'm actually being ignored. So that added on top of my mental health. And after the 4th time being sent home, and I came back, and my mum very much advocated for me in that moment, where we both said, I'm not going nowhere. She said, my daughter's not going nowhere. As I sat down in the waiting area, reception, my waters broke. And I just remember, turning to the receptionist, she looking quite stunned. I had a flood of midwives come to me. I was wheeled into the delivery room, and within 20 minutes my daughter was delivered. Now, I know when you have birthing plans never go accordingly. I'll be very lucky, and I was not oblivious to that. But for me, I didn't feel comfortable. I was pacing up and down to the hospital, not listened to, feeling very frustrated. And I just burst into tears when they placed my daughter on top of me, as the skin to skin. And I just started crying, and everyone in the room just assumed it was happy tears, but it was tears of frustration. It was tears of, I feel failed, because I know what a good birthing experience looks like. I experienced it, and this second time round I didn't get that. And I needed the health sector more than anything during that time because of my mental health. So I went home. I just felt myself not connecting with my daughter. I would wake up in floods of sweat. I would prod her just to see if she's breathing. I had very much intrusive thoughts, her going around and around in a washing machine in circles. And I just remember turning to my relatives to seek support. And, as you can see, I'm a Black woman, background Ghanaian, my partner Nigerian. Trigger warning, when I did try to talk about my mental health to them, they told me to pray about it. They told me to Christina, you should be grateful. Some people can't even have children, and you've got two beautiful ones. During my time, I had it worse. And yes, rightly so, they did have it worse back in the day. But we're in a time of day where we should know better. And, with the comments about other people, I should be grateful. I had to, literally say, oh, you know what, that's true. Let me put on my big girl pants on and just completely dismiss my feelings. And that is where I went wrong. It was for me, what was my lifeline? Because if I didn't have that lifeline, I don't know, I'll be completely honest, and I don't shy away from it. I don't know if I would be here. And that lifeline was my manager at the time. When she saw me, I came into work, she wanted to have a chat with me, catch up. And as you can see, I love getting my nails done. Look, you can have a look there. I absolutely love it. But underneath my nails, my skin, it was raw red because I was biting and picking it out of anxiety. And she just simply looked at my hands and looked at me and said, how are you? And I just burst into tears. And she was the first person to actually ask me, how am I? And she told me to actually go and I should go and see someone, my GP. And I did exactly that. And that experience was just horrific, very much a tick box exercise, wasn't body language, no eye contact. It just wasn't great. And I just remember my shutters went completely down, locked with a padlock, and I threw away the key and I just decided to take on my own healing. And that's where the Motivational Mums Club was reborn, to really focus on mental health. And that became my journal. I really wanted to normalize these conversations, but then also create a space where healthcare professionals can tap into to learn about, cultures, give them that cultural intelligence, but more importantly, to really break the stigma and barriers of these conversations within the Black community. Because as I just said, very much so in our culture, we're told to pray about it and keep quiet. And it's something that we need to work on.
Thank you very much for sharing that, for being so open in that account there. And I'm really sorry you had that experience. It sounds like it, well, doesn't sound like it. I can hear that it was a really tough one for you. But thank you. One thing that resonates with me, and I mouthed it as you said it, when you said pray, that's one thing with our cultures, that's what we're told. You say anything, pray. And whilst there is prayer, there are services to help.
Exactly that.
Yeah. Which brings me into the next question that I wanted to ask. So the Mental Health Foundation published a recent report that Black mothers are disproportionately affected by cultural barriers that hinder their access to mental health care. Not only that, but mental health stigma and feeling judged and unheard are common barriers faced by Black mothers during pregnancy and early parenthood. This is compounded by the claim that Black women have increased risk factors for mental health disorders due to higher levels of trauma exposure throughout their lifetime. So I think I want to start with Laura. Do you think it's commonly known among midwives and other professionals who provide maternity care that these factors exist? And how does maternity care differ for Black women based on cultural barriers which exist?
So I think what Chrissy said was very true. And just to note, Chrissy, that every time you tell me that story, I'm so glad you're here. Yeah. So I wanted to say that first. But I think we're moving towards having better understanding. And what Chrissy said nailed on the head was that there's no excuse not to know. This is like Chrissy and I are colleagues with Chloe and Tanuki from 5 Times More. These reports have come out time and time again. It's not just mortality, it's morbidity, it's the babies, it's the mental health. That there are things that definitely need to change, and we can't keep just saying, oh, it's that there's hard to reach kind of thought. So I'm hoping that more and more midwives should definitely know that by now, but it doesn't always happen that way. I think that there shouldn't be an excuse either anymore for that either. So when we're opening up services, when we're opening, like for example, the Helix service that I work with now, we collect data and we look at our ethnicity. And because we know, sadly, that Black women are more likely, and actually I should say, so this week is Black Baby Loss Awareness Week. And we know that sadly Black women, Black mixed heritage women, South Asian women have poor outcomes for their babies as well. So we need to be looking at who's accessing our services. Are we meeting the needs? So if we're having majority of white women attending our groups, what are we doing wrong? Because that's not who we should be seeing. And so linking with services like Chrissy, like the Mamas Together group. We did a session with Muslim mamas. I didn't realize, you know, at that session, the women in that group were saying, oh, I didn't know that I could go to antenatal classes. I was like, antenatal classes? Like, I thought that was like a generic thing that everybody knew about. And then on the flip side of that, some said, oh, I knew about it, but I walked in and it was all white women. So I felt very uncomfortable and I was worried I couldn't talk about my faith. And then things like about birth outside of guidelines. And then so when we're thinking about mental health, because I think that was the second point about barriers within a lot of the services that we offer within mental health services is quite white Eurocentric therapies and services. So that is one problem that we need to make sure that we're always looking at that. I've read now that there's some CBT that includes Islam. So if we're thinking about supporting our Muslim community, that we're kind of thinking about that. That's really important. Their faith is involved in their healing. But they were also thinking about the people that are in our team. So that it's not that people can see people that look like them, because that's quite a helpful barrier. Yeah, so I think the big thing is thinking about there's no excuse anymore. We all need to take action. And yeah, so that would be my.
Yeah, I think just to follow on from that, I think it's very important to make it very clear that we are here to support absolutely everyone. Every single person that is a mother, regardless of your religion, your race, your age, it doesn't matter. Everyone is entitled to that same support and care. However, what we are trying to achieve here, so going back to your last question, when it comes to Motivational Moms Club, you know, we provide free mental health sessions with 2 fully qualified psychologists with to mothers, doesn't matter where you're from. However, we need to think about making the service more equitable. And this is where my Mamas Together peer support group comes into play and plays very, very, very heavily in the community. And that is to educate, to create that trust, create that relationship with a community that never had that relationship with the healthcare sector. Because yes, I completely agree with you, Laura. We're in a day and age where it's not an excuse. Everyone should know this. So we should all know this. It should be embedded into training and, more importantly, be seen on the ground with the community leaders like myself to make these services more equitable and to let the, regardless what community it is, that need that extra, you know, support to know what is going on. So for me, it's about making the service equitable, because it's not like, you know, one group is favoured. Absolutely not. And a lot of the time I have heard that no group is favoured. It's about giving that extra support to a community that we can see what the disparities are. So what we're going to do, what steps are we going to put in place to make sure that doesn't happen? And we can do that, but then we need to also make sure the next generation, they do get better care than what we receive. And that's where Young Positive Mind comes in. See how I just shut down because I was told just to keep quiet and pray. We're normalizing these conversations. And if we normalize these conversations with ourselves, we filter it down to our children. And it is a very long way to go. But then if we start all of these things, surely, you know, the change will happen and we will see it. It may not be in my lifetime. I don't know. I may not see it. But if my daughter chooses to have children, I would like to see, or my son, I would like to see some sort of massive improvement in the service that I didn't actually see. And that is more making the service equitable for all. So that's to answer your question.
Right, thank you. I think you've kind of answered a bit of my next question. I was going to ask, how can the LMC support? And you said something about education. And is it something that we probably need to sort of have clearer in our standards, have clearer in the way that that we sort of look at the programs that we have, so that that awareness is there? Because it's great that there are well, it's amazing that there are people like you that are raising the awareness in your individual ways. But as you said, there is a lot to do to make sure that it becomes something that everybody does, and it becomes the first thing for everybody. And maybe one place to start is from our education, for midwives, for nurses. But is there anything else that you think that NMC can do to support organisations like your organisations?
Yeah, I would always champion that, and that is to work alongside, collaborate, partnership with community leaders like myself, because we have our fingers in so many pies, but then there is a very strong dotted line, isn't there? So training, having spaces like this, just a webinar just to really talk about it, just us having this rich conversation. I'm sure probably colleagues are pulling bullet points from it, to learn from it. So this is where you can do more, and it shouldn't just be on an awareness week. It should be embedded throughout the year. And I've always championed that. Always do it throughout the year to ensure it's always in the forefront of someone's mind, and it's just more or less just a reminder of what is out there. And that's how you can contribute and work alongside us, create material with us. There's so many ways we can tap into working with each other. It's just about the way you go about it.
So I think that's sort of raising awareness in how we provide and support. But also I think there's something about raising awareness about the cultural barriers that still exist that hinder Black mothers' access to mental health care. So is there anything you think we can support sort of from the actual mother's perspective? Is there anything else you think we can do for women to help? Because, I go back to when you said, about being told to pray and being told, I mean, the birth trauma report has come out, and it resonates so much with what you said about not being listened to. So is there anything that you want to share, I think for both of you, that we could assist with, or you feel that it's something that would help from our perspective?
Can I be very honest?
Yeah.
I'm going to be very honest.
Please do.
And there's an American that has this great podcast who says, now let's get uncomfortable. So I just want to say something that I think for me resonates as a midwife who's had the joy of working with lots of amazing women like Chrissy, is that, and for staff, because I'm part of the anti-racism framework with Capital Midwife in London. And some midwives don't feel safe as Black midwives, and sometimes Black women don't feel safe in healthcare. I know there was a high profile case with a midwife that something was said and then nothing really happened. She was allowed to kind of go back to work, and it caused so much trauma for the Black community, having that trust with midwives. And for me, I thought it was such a missed opportunity, but it's never too late to say sorry. It's never learned to learn from our mistakes and to move forward. And I would love for us to have more stuff like this, where it's like you can be really honest. You can celebrate the incredible stuff that Chrissy's doing. We can make our midwives feel safe, because sometimes they themselves don't feel like, if they've experienced racism in the workplace, or they can see women are being treated differently because of their ethnicity. So yeah, I think more safe spaces for people to be able to speak up and kind of learn from past things, to make it a really nice place, and for a place for us to be able to say sorry. I said that and that was wrong. I made a mistake. What can we do to fix this for the community? So that would be my joyous love for the future for midwifery and nursing.
Great words. Thank you very much. Thanks. And thank you for your honesty, because we do need to have these honest conversations, because that's the only way we can move things forward. I wanted to ask, and it resonates with me again through the birth trauma report, about the importance of delivering holistic care, and what are some practical ways that midwives could signpost Black mothers to the support and advice from organisations like Chrissy's organisations?
Yeah, so Chrissy, spotlight on Chrissy again, is just that one of the great things about the Motivational Mums Club is that they're based in a children's centre. And the Greenwich one, specifically, it runs while there's a midwife clinic on. So there's like a midwife that could be there. But another joyous thing from the group is that we've had healthcare professionals come to the group. So we've had sexual health nurses, we've had GPs, we've had social prescribers, we've had pelvic health team, which again, I didn't mention with the talking about exercise, the pelvic floor, do your pelvic floor. Men and women forever your life, but kind of talking about that, and the conversations that happened with those in those groups were so powerful, because we know, you know, women want to look after their own health, but they've got children to look after. They can't get to the GP appointment, or they can't find out about their sexual health. They didn't even know about the pelvic health team. So I think having services like that, where you're in the same area, you can talk to one another, you can hear firsthand from women, you can build trust with them as well. So like, oh, who is this midwife? Because it must be so scary for Black women right now, because everything in the report, you said the trauma, birth trauma, there was a whole chapter about global majority women, isn't there? And embrace, it's just repetitive. So to know that actually majority of midwives and nurses really want to care for you and really want to do well, and to be able to build that trust, but for us to be able to hear as well from the women to say, I can't access that clinic because it's always on the same day and I work that day, or I got childcare issues, or I didn't know about, for example, GDM, didn't know that I should be screened every year for type 2 diabetes. Like all these kind of information and conversations that can happen in a community scenario, just wonderful. Yeah, to have hubs like that is lovely. Fun more Chrissy's.
Yeah, I think just to follow on from that, and I think it's also good as healthcare professionals to understand what's going on in your community as well. But then more importantly, have a conversation, talk to that mother. At times, you know, we're just giving so much information that it doesn't seem like sometimes a two-way conversation. And it's those little things that could, you know, chip away that barrier. You know, if we're talking about care, include that person, that mother/birthing person in their care, ask them the relevant questions. And yes, sometimes we're not going to you know, crack that barrier, but then if we can leave information with them before, you know, you go, at least it's something that they can always refer to. Understand that person as a person before they were even a mum. And I think that is absolutely important, because that will give you a really good foundation in regards to that person that's in front of you, for you to give that holistic care that includes them as well. Really understand. And I do know that everyone is stretched with time. I do know. But how can we make that time impactful? And that is to ask the right relevant questions, and to, at least when you are not getting those answers that you are hoping to get, because you can clearly see something different, at least you can give them information that they can take away with them. So that's just to add from, you know, to what Laura said, because I completely agree. It's just to understand what's in the community, work with the community, in the children's centres, GPs, put the posters up of like different community groups. The other day, I was actually taken away, Laura, completely off topic. I went into a GP and I saw my Mum is Together group poster up there. I literally welled up, and the receptionist asked, everything okay? And I was just like, that's my group. And she was literally, it was such a beautiful moment, because I wasn't expecting it. And that already tells you, you know, yes, I started the group in September, but with perseverance, you know, pushing, the passion, the right people behind you, it will go out, it will get there. So I just want to really you know, push that.
Sounds like a really proud moment for you. That's great. Thank
it was
you.
a proud moment for the mums. For me, it's for the mums. You know, I'm the face and I'm the one that's pushing it. But for me, you know, as I always say, if we can save one life, gosh, doesn't it not just make it so worth it?
You said something earlier about might not be in your lifetime, but you know, I think a lot's going on now that can push for things to change. So yeah, thank you for everything that you're doing. But one question, and I want to start with you, Chrissy, that, you know, you've told me about everything you do. And even then, when I sort of said to you, you said for the mums. As a mental health advocate, how do you look after your own mental health while doing such a busy and critical job?
That is a very good question. And it's something that I'm still yet to master. if you want me to be honest with you.
Yeah.
It's still something that I'm still mastering, but there's one thing that, oh, I'm going to get emotional now. There's one thing that my lived experience, definitely showed me, is that give myself grace. Give your time just to stop, take everything in, and there's always tomorrow. I'm not trying to do everything right now. And because of that, I do allow myself a day off. I like to go swimming, get my nails done, some sort of self-care for me. I have to do it at least once during that week. So for me, yes, it is a very heavy job that I am doing, but the way I give myself grace is to be still. And how that still may look like, the kids could be at school and I'm taking a nap. Because I don't know if I did mention this. I may not, but I did definitely take on that huge decision, a massive decision to resign from the investment banking industry. So I don't work. This is what I do full time because of my passion. And in that moment of time, I had to choose me or work. And it was one of the best decisions I have ever made. And that was to choose me. So for me, what I do to look after myself, that's what my lived experience taught me, give myself grace and choose you once in a while. And yeah, that's how I look after me.
Thank you. Well, it's good that you take some time for you, because you have so much passion for what you're doing. So you do need some space for yourself. And to you, Laura, what do you do to look after you?
Surround myself with people like Chrissy. Definitely is very uplifting. There's definitely been moments in this group, like I'll never forget the Christmas session we did where it was all broke out into singing. Like people were walking by the group and were like, "What is going on in here? How do we get invited?" I'm like, sorry, this is VIP. So it's just moments like that give me joy. It's similar to Chrissy being having a time to just be. Being with my son, being outside. Music for me is definitely saving grace when I'm feeling low, don't want to do the dishes. Put some music on. But also as a midwife, I'm very blessed in the maternal mental health service. I get restorative clinical supervision regularly through the psychology team. So I meet with them once a month and I can talk about difficult conversations or, even barriers when we're trying to get Chrissy's group up and running, like sometimes just feel like you're knocking on door. And so sometimes that can feel a bit heavy. We're supporting families who've experienced pregnancy loss. It can be really heavy. And then as a midwife, the stuff on the news, it's, it used to be a joy to be so job. I am still proud to be a midwife. I love being a midwife. But right now, it does feel a bit like, oh gosh, I don't know if I want to tell people I'm a midwife because it's not the nicest place to be. So I think on that side, surrounding myself with other midwives and talking about how we're going to try and improve things also brings me a lot of joy. Like the conference we did a couple of weeks ago. Yeah.
Brilliant. Glad that you've both got ways that for self-care, because it is very important. So finally, before we go to questions, could you just give me each one thing that you would like colleagues that have been on this call today to take away with them? Should we go to you first, Chrissy?
Yes. God, what could that be? If you can take anything away, I would say it goes back to what I said previously, to really understand that person sitting opposite you, because that will give you some sort of good understanding of their background, their cultural barriers that could be presenting to them, regardless of what that could be. Is to, really answer a question directly about them. Yes, their care is meant to be about their pregnancy, but one or two questions about them, that human connection there is very powerful. All of a sudden the tables can turn, and that can actually create a conversation that you could actually help that individual. So for me, if you can take anything away, it would be that.
Thank you, Chrissy. And Laura, sorry, I didn't realise I was on mute there.
Yeah. So one thing that's resonated with me recently is Chrissy and I were both at the motherhood conference a month ago, 2 months ago. I don't know.
Yes, 2 months,
It was a while
2 months ago. Yeah.
2 months ago. Yeah. And Trish Belusa was there, and she was speaking. And I don't know if you know, she's like a social media kind of celebrity. She's been on Big Brother, but she's also an incredibly wise, wonderful woman. And she was talking about, like Black women have this image of having to be strong all the time, and how that's mistreated women. And she said that her dream in life is for Black women to be vulnerable and to have a space where they can be vulnerable and they can have a soft life. So for me, that would be my dream, is that Black women can come in and be like, I can tell you I'm really sad, I'm really depressed, without worrying that you're going to take my child away. I can tell you that I've got this pain and I know you're going to hear me, instead of being like, I'm going to have to fight for this. So my dream would be for Black women to be vulnerable and have a soft life.
It's beautiful. Thank you.
Yeah.
Thank you.
Yeah.
This has been a really inspiring and uplifting conversation, very insightful, very powerful, and I'm in awe of the passion that has come from both of you. So thank you so much for taking the time to speak to us today. We are running out of time because we started a bit late, but I will still hand over to Bethan to see if there are any questions. And what we may do is, if there are questions we can't answer, then possibly we send them to you and you answer and give the answers back to us, if that's okay. Bethan, are there any questions that you want us to pick up on?
Hi everyone. Yeah, there's a few questions from the audience, so I'll see what we've got time for. So the first one would be, what can we and other professional regulators do to help support a space where midwives can speak up about experiences of racism?
Do you want me to answer that one? Yeah. So I can't speak highly enough about the anti-racism framework that we started doing with Capital Midwife. So I'm part of that at St. Thomas's, and we're trying to roll it across Southeast London, because it's been able to open up those really uncomfortable conversations. No trust is perfect. No trust is without that. It's systemic. It's everywhere. But one thing we've noticed is that when we're encouraging staff to speak up about racism, is it gets to a certain level and then there's nowhere further to go, there's nowhere further to escalate it. So I don't know, if my dream would be that there would be some way that if staff have been brave enough to speak up about their experience, that there's an actual way that the change happens, that it's not been like, oh, he said, she said, we can't prove it. I've noticed that recently now, for the first time on day texts, you can actually put racism as a possible complication. So things like that are really important and really great. And just that, I really feel like there needs to be that safe space to be like, I got it wrong and I am sorry. And if you're not sorry, then you leave the profession, because we need to be in a space where staff feel safe, women feel safe. And I do really think that 99% of us are in that mentality. Yeah, so that would be my thoughts on it.
Thank you.
Thanks so much. And then someone's thanked for the powerful experiences you've all shared today, and mentioned that there's obviously no silver bullet, but if you could give one piece of advice to midwives to help improve experiences, what would it be?
Chrissy, did you want to take that one?
I was going to say, who's going to go? Should that be me?
Yeah.
Listen. You can say that sometimes we're like, well, yes, we've heard you, but are you really listening? When that woman is saying that she doesn't feel, I'm going to use a perfect example. I don't know if anyone knows about the story of Nicole Thea. Nicole Thea, she was a very, very, very popular dancer, influencer online. She's danced for the likes of Chris Brown, very, very high up there. She was pregnant with her firstborn, a boy, and she kept saying to healthcare professionals, including midwives, I'm finding it difficult breathing. I can't, is this normal? It's her first pregnancy. And every single person along the line said, yes, it's normal. She mentioned it ample times, and it actually required one person one person to actually refer her to get further tested. No one did. And because no one listened to her. You're hearing her, but you're not listening, are you? You're not. And unfortunately, that led to her passing and her son. He was only born and he only lived for 6 hours after she died, leaving her partner and her mum and her dad. She was the only child. If someone had just listened, that life could have been saved. So if I was to give any kind of advice, it's to really listen. And it doesn't hurt to make a referral through the, multidisciplinary teams. That's why they're there. That's why that model is there. Tap into it, use it, and really listen and make sure we are actually, even if it is nothing, so what? At least we've checked and we've heard. So that's what I would say as my answer to that question.
Great message. Thank you very much. I think we've run out of time now, have we, Bethan?
We've just got one more question.
One more? Okay.
And it will be for Laura. So given that this year's Mental Health Awareness Week, we've had, and the theme is movement, obviously, we've had a couple of questions about the aquanatal classes you mentioned at St Thomas's. So you're able to give us a little bit more information about it. I think specifically there's a question about, is it safe for expectant mothers during the entire perinatal period? And are there any other widely used interventions to support the mental well-being of new mothers via physical activity?
Yeah, so the training course I did, there was midwives from all up and down the country. So there's definitely different parts of like Manchester, Liverpool. You just need to see if there's other aquanatal classes being offered. It's pretty much safe for everyone. The only, when we register people, we asked that they waited until they'd had their nuchal scan, just and possibly even their 20-week scan, just know where the placenta is, because we didn't want anyone in the pool with a low-lying placenta. If somebody had a high-risk pregnancy, and we would speak with the consultant to see with them what they thought, because actually being in the water, you're more buoyant, so you're lighter, you can move more easily. The water isn't deep where we are, so it just goes up to like the bust line anyway. So people who weren't very confident swimmers could still get in. So it's very accessible exercise, and nobody can see you under your bus. Nobody knows what you're doing. So even if you're not doing the moves right, nobody's going to be judging you. And we involved things like pelvic floor exercises into that class. We talked about preparing for baby, looking after your mental health. So it was like a holistic group. If water is not for the women, there's some really good information on the Tommy Charities website. It's got a list of loads of different exercises that women can access. But I know women used to be scared about running. If you're already a runner, things like the park run and running is still really safe and really good for you and really healthy. But if you've never run before, now is not the time to sign up for the London Marathon when you're pregnant. So it's getting like kind of general advice from your obstetrician. yeah. So yeah, oh,
sorry, I think we're getting a bit of feedback from the audience there. I'll try and
okay.
Someone said I do.
yeah, no problem. Yeah, so Tommy's charity website's got great links to stuff to do. If you already exercise, please keep exercising, and if you don't, getting out for a walk every day. There's lots of like groups now that they meet for pram walks. So yeah, definitely keep up the exercise, and your pelvic floor exercises are so important for the rest of our days. So if you're gonna do anything today, go and do that. Yeah.
Brilliant. So once again, thank you so much for coming and speaking to our staff today. And I hope everybody's enjoyed the insight into Black maternal mental health discussion that we've had. I've thoroughly enjoyed it, and I've been really inspired by both of you. So thank you once again. Thanks, everyone. Bye-bye.
Thank you.
Thank you.